My name is Dr. Felicia. I'm a licensed psychologist, and today I'm going to be talking to you about what to expect when you start ERP therapy for OCD. ERP is known as exposure response prevention therapy. So a lot of times when people are, diagnosed with OCD and are expecting to begin treatment with ERP, there are a lot of questions as to what it's like, how is it different from other therapies? And so I'm going to go over briefly what the process is like. All right. I'm assuming by this time you've probably been already diagnosed with OCD. You've gone through a diagnostic assessment, which is basically when you do some different types of tests, ask different questions to determine whether OCD is present or not. The first thing you're going to do in therapy is you're going to create a hierarchy. And a hierarchy is the heart and the essence of your treatment plan. And that starts out with, it goes from bottom to top. The bottom there are things that cause you anxiety, different things that can trigger obsessions and compulsions, basically. So a hierarchy is like a trigger pyramid. And at the very bottom, you're going to have different things that are least triggering, and then you're going to work your way up. Okay, so let's say somebody has difficulty with germs, for instance. That's known as contamination OCD. Something at the bottom may be thinking about not washing your hands after picking up something from the floor, something like that. So basically your hierarchy, treatment plan, going from the bottom with what's least triggering to the top, most triggering, you're going to work your way up slowly. Something important for people to understand when they're doing ERP is that ERP is a very active and engaging type of therapy. Sometimes people have the misconception that when they come into treatment for OCD, they're just going to sit back and the ERP is going to happen to them. But that's not the case. The clients that I've worked with who have gotten I'd say made the most gains in the shortest amount of time, and those gains have stuck with them, are the ones who dive into ERP head first with sort of like a bring it on attitude toward anxiety, right? ERP is a very active and dynamic form of therapy, and you really get out from it what you put in. It's not easy at all. When people are doing this type of therapy, you're going to have to deal with what triggers you. And sometimes, I'll say oftentimes, symptoms get sometimes worse before they get better. And that's simply because you are dealing with issues that you have been avoiding for a very long time. So it's important to understand that and prepare yourself for that, because sometimes people have this conception or misconception about treatment that it's just something that the therapist does to them, and throughout the process they'll just get better by absorbing ERP, and that's not how it works at all. ERP is just as much what the therapist does as what you as the client does, and so you have to really go into it engaged and doing a lot, and a lot of the work comes not only from what you do in therapy but outside of therapy. So think about playing a musical instrument or sports or something like that. You can go to practice, you can go to lessons, but where the real work takes place and where the real change takes place is the effort you put outside of those scheduled sessions. So it's really important to do that. Also, ERP tends to be very present oriented, right? So sometimes people think that therapy, or all types of therapy, are situations where a therapist asks you about what happened in your childhood and what was your relationship like with your parents. And ERP does very little of that. I mean, that might be part of it if it's related to a specific exercise, but ERP is present oriented, and it tends to be a little bit fast paced. Not in a way that makes you feel uncomfortable, but it's active. Okay, so there are not going to be a lot of questions as to why do I have OCD or how did I get OCD, but rather how can you get better and what is preventing your progress. Okay, and it's not that those questions aren't important. I mean, people are curious about how they got OCD, but again, the goal of treatment is for improvement and to really focus on the present and what changes you can make in your behaviors, and also the way you think, so that you can make progress. So that's another thing. So I'm just going to recap what I've said. Briefly, the first thing is that ERP involves a hierarchy, and we've talked about the hierarchy already. So basically, the core of your treatment plan. triggers that are least triggering at the bottom, what triggers you most at the top, and you work your way up. The second thing is that it's present oriented, and it tends to have a bit of an active pace to it. Okay, we're not going to do a lot of delving into the past or why you think you have OCD and things like that. Also, another thing about ERP that is important to realize is that you're not going to get reassurance from your therapist. And so this can be unnerving for some people because they're used to a therapist providing them reassurance and telling them, okay, this is going to be okay. These bad things aren't going to happen. And that is actually counterproductive with ERP. ERP is helping you get used to being uncertain. Part of what happens with OCD is that people want this sense of certainty and control, and that's understandable. But as a therapist, the therapist is there to help you get comfortable with being uncomfortable. And so there isn't going to be reassurance because reassurance can actually make those symptoms worse. There's going to be validation, meaning, yeah, I understand these symptoms are tough. I understand this is difficult to deal with. However, no reassurance. And so it's not that your therapist is being mean to you, your therapist doesn't like you. It's nothing like that. This can be just as challenging for the therapist as it can be for the client. I know that for myself, it's difficult to see clients going through uncomfortable situations. However, I see the other side of it, and I see the improvement and the gains that are made from sticking with ERP. So that is really important to remember, that there isn't going to be reassurance, there is going to be validation. And I talk about that as well in one of my other videos, the difference between reassurance and validation. So that's also something that you can look into as well. So these are important things to remember when you're doing ERP. It's important to remember that the process takes time. You can't just expect to get results overnight with it. However, you will get into it or get out of it what you put into it. And so that's it's really important, and to remember that. And then also another thing that's really important to remember with ERP before I forget is that the goal of ERP is to help you manage manage the different obsessions and compulsions that come up. Sometimes people think that they're coming into ERP and they're going to get rid of every anxious or anxiety-inducing obsession that they've ever had. And that idea is not accurate, and also can be counterproductive to therapy. What ERP teaches you to do is deal with that noise, that background anxiety noise in your head, and have it not stop you from doing what you need to do. If you have OCD, you can identify with the fact that there are a lot of things that you're not able to do or able to be fully present with because of the obsessions and the compulsions. And so, there are going to be times when people have fewer obsessions and compulsions, and there are going to be times sometimes where it's they come back with a vengeance. And what ERP teaches you are the skills and the tools to deal with that. So again, you want to go into it understanding and having realistic expectations about what you're going to get from therapy and how you're going to learn skills and different tools to help you cope. Okay, so it's a gold standard for treatment for OCD, and people who use ERP for OCD as opposed to other forms of therapy tend to improve with their symptoms. And so it's important to realize that, and it's important to help you. It's important to know that rather, and keep that in the back of your mind as you're going through therapy. And so if you have any questions about it or you want more information about that, feel free to book a free 10-minute consultation with me on my website, and the information is in the description box. I hope you have a peaceful and a wonderful day. Bye-bye.